Good evening, friends. This is Dr. Avinash De Sousa, and we're here for the webinar on autism parenting, the best approach to each challenge. And I'm very thankful for Autism Connect to have me here on this webinar. We're going to deal with a number of issues today, ranging from parenting to something about parents, to something about parents and children, and multiple other things that comes up during the entire autism parenting journey. It's a very difficult journey, a rather complex one. There are some pleasant moments, some not so pleasant moments. So I will share with you more of my experiences that I've had in talking to, sharing with, dealing with parents of children with the autism spectrum disorders, certain problems that they undergo, certain triumphs that they've had, and how we have overcome challenges that are faced by these parents. Why are we here today? We're here today because the challenges in parenting a child with autism spectrum disorders is huge. The challenge being huge is primarily because one not only has to parent the child, one has to understand the child, one has to understand autism as a condition. It even boils down to having the child do well at a school level, having the child do well at a community level, and as the child grows, challenges come up. It's worthwhile mentioning that challenges in parenting are seen across the lifespan, and they are seen at every age epoch. What I mean by this is when the child is small, and very often the first challenge is when we look at probably getting a diagnosis of autism, being sure about that diagnosis, which specialist to meet, what to do, what therapies to undertake, what would work for the child. As the child grows and his schooling starts, then we have behavioral issues that probably come up. We have issues related to his growth, issues related to his eating, issues related to his hyperactivity, which may come up. And as the child attains puberty, then we have to worry about his development, certain sexual issues that may come up. And finally, as the child ages and becomes into an adult, the parents also age and are moving towards their middle age and old age. Therefore, challenges in parenting are seen across every life epoch. It's very important that we go today with this premise that every child in the autism spectrum is highly individual, and we do not really have guidelines where one size would fit everyone, and the one size fit all model doesn't work here. It's very important that we have guidelines which are highly individualized, because you have some children who are social, some who are asocial, some who are good with eye contact, some who are not so good with eye contact, some who mix well with others, some who don't mix well with others, some with speech, some without speech. So each child's individual capacities, capabilities, environment, family, parents have to be taken into consideration while overcoming every challenge. And we generally have an approach which is individualized to suit the needs of every child and every family. One of the first challenges, like I mentioned, is issues related to diagnosis. So it's very difficult to accept sometimes and confirm a diagnosis of autism spectrum disorders. When I mean here, it's not difficult for probably a physician or a mental health professional or a pediatrician or a neurologist to diagnose the same, but it is rather accepting and confirming the diagnosis by parents that is a problem, because in the beginning, once autism spectrum is diagnosed, there is always that little bit of concern whether it's actually autism. Maybe it could be something else. Maybe it could be another developmental disability. Autism is probably a little harsh as a diagnosis. Maybe it could be something else. You may have specialists who have variations in the way they probably diagnose autism spectrum. So you may have some uh, specialists who might say, yes, we'll wait a few years, then we'll diagnose. You have some who diagnose at an early age. You have some who uh, may not confirm a diagnosis. So parents may very often move to more than one therapist or more than one mental health professional or more than one physician. And confirming a diagnosis of autism thus becomes a challenge as well. But with proper testing, proper assessment, it's definitely possible to confirm a diagnosis of autism spectrum as early as possible. It's very important to also understand what do we mean by the word spectrum in autism spectrum disorders. Parents very often come and mention that my child lies on the autism spectrum. We primarily mean that we could have children across the board. You could have children with very high intelligence, who we refer to as the high functioning, children with normal intelligence, and children with low intelligence. We could have children with hyperactivity, children with lethargy. You could have children with aggressive, abusive behavior. You could have children with very timid behavior. You could have children who are not at all interactive socially. You could have children who are interactive socially. So the spectrum means that children with the autism disorders, they lie on a continuum, and that continuum is highly heterogeneous and varies. And therefore, parenting a child is very difficult because there's no single means of parenting. Each child's needs, wants, etc., have to be taken into consideration. More than accepting a diagnosis of autism spectrum, it's very important that parents personally accept that the diagnosis exists. Because very often, what does happen is that many parents may say, we have been to so many doctors, but my heart doesn't agree that the child has autism spectrum. This is purely a parenting issue where parents may always have the bias that why is it that my child is probably being diagnosed or labeled as autism when he actually is probably not autism. So personal acceptance and understanding of the diagnosis is very important when it comes to working with the child in the long run. Whenever a diagnosis of autism spectrum disorders is made, there are mixed emotions that we see on the part of the parents. The first is, of course, disbelief. They may not be in agreement with the doctor and they believe that the child is not autistic, and probably the doctor is too early to diagnose the autism spectrum, and this is something which has to wait. There may be a large amount of anger as to why the child has to be labeled as being autism spectrum. There may be a large amount of anger as to why is it that my child has to probably suffer from the autism spectrum. There is a lot of guilt because multiple tests, genetic, otherwise, do not pinpoint to the cause of the autism spectrum. So a lot of guilt as to how did this child become like this? How was he born like this? Was there some neglect on our part? There is also a lot of sorrow and sadness because obviously accepting a diagnosis of autism spectrum is not going to be easy at all. And it would definitely sadden every parent to have their child diagnosed with autism spectrum. So there is often a lot of bargaining that happens that, okay, probably we'll wait a year, we'll reassess, we'll try out with therapies, we may find that there may be improvement. And so a lot of bargaining does happen. And finally, we have the stage of acceptance that, okay, we accept finally that the child probably has autism spectrum. Why is autism spectrum difficult to accept? Because in most cases, the child has had normal behavior and normal milestones for a period of 1 year, 1.5 years, and after which the deterioration starts. Therefore, a diagnosis of autism spectrum is a little difficult to accept for most parents because they feel that autism is a lifelong diagnosis. There is no cure, there's no treatment, there's no reversal of the disorder, and rather the associated symptoms have to be treated. So before one accepts a diagnosis of autism spectrum, there's a lot of to and fro. Multiple physicians are consulted, multiple psychiatrists are consulted, multiple pediatricians are consulted, multiple pediatric neurologists are consulted, and then once more than one doctor probably diagnoses the same, diagnosis of autism spectrum is accepted. In the initial years of parenting, one of the biggest challenges is what is the right therapy to give the child, because there are multiple therapies available. Occupational therapy is there, different forms of occupational therapy is there. There is a focus on vision or visual based OT. They have occupational therapy conducted by different therapists in different settings in different ways. So whether we are at the right therapist and whether the results that we are getting are satisfactory is what also worries many of the parents, because they may go for therapy twice a week. But it's important for parents to understand that occupational therapy with autism takes a long time for results to show. So you may have to wait 3 months before you see some change, and you may have to continue therapy for 6 months to a year before you see complete change or some amount of reversal of the symptoms. It also is very difficult for a parent to decide on the schooling journey of a child with autism spectrum. Should he be in a mainstream school? Should he be in an inclusive school? Should he be in a special school? The answer is very difficult because each child's capabilities, ability to understand, his knowledge, his academic prowess, his social skills are all taken into consideration before deciding which school he might go into. Some children, possibly after the 7th or 8th standard, may have to opt for an NIOS kind of schooling. So, depending on the type of schooling that the child has, his or her development in future does happen. It's very important that children realize that parents realize that initially the child may have to be in a special school or an inclusive school and slowly shifted to a mainstream school while improvement happens. A very important question that many parents ask is, why is my child different from others? The reason is that children with autism spectrum are definitely different because they do not maintain eye contact, they do not mix socially, they do not interact with other children. So even in family gatherings, very often they are in their own world. They might make a lot of noise on the table, on the chair. There are certain objects that interest them. Their entire behavior and demeanor is different. So you will always have relatives who feel that, yes, these children are different from others. And uh, the parents of a child with autism spectrum may face some amount of ridicule, some amount of hate, some amount of angst, which can therefore also cause problems and be a challenge for the parent. It's very important to understand that we have very few schools in the city of Bombay that we can actually call autism friendly schools. And it's very difficult that it's actually a dream. We don't really have autism friendly schools. We primarily have schools that may cater to some needs of children with autism, but we don't really have schools which can encompass and provide all services to a child with autism. So, forming such schools, of course, is a dream that we have to pursue because there is no reality here. But the key issue is that, is inclusive education provided by certain schools actually inclusive, or do they segregate the child? So very often for parents, the difficult part is the brigade of inclusive education, who to trust and who not to trust. And very often there are children who are taken into a school that proposes to be inclusive. But over time, once the child doesn't show improvement, they are eager to send the child back to a special school. Inclusive educational settings are one that works with all the challenges that the child has. And no matter what, they never give up on the child. So the inclusive education setup needs to have a special educator, an occupational therapist, a speech therapist, and multiple other therapists at their center itself for availability to happen. It's also very important in schools that parents have to understand that they have to handle criticism, failure, and other parents. So you will always have teachers that criticize probably things not right. Children may not be able to do simplest of tasks. They might fail again and again. There may be problems related to their understanding, comprehending, speech, etc. There may be other parents that may complain if a particular child shows behaviors which are slightly abnormal or behaviors which involve touching other children, and which is not necessarily sexual in nature, but it may be sensation seeking. Also, for that matter, the child may not adhere to school timetables and environments. He may not like rigid enclosed environments, and he may not like timetables which are time bound. He might want to be on his own. He might prefer environments which are more open. And it's the duty of schools to provide such environments to children with autism spectrum disorders. The key issue also that comes up as one of the challenges is the choice of what type of education one has to offer. Depending on, there are many factors that decide this. It depends on how good the child is in academics. It depends on the IQ of the child. It depends on the capability of the child. So you may have children who in a mainstream school may do well if they're capable. You have a group of children that need an inclusive school, and you may have some children that while being on the autism spectrum may also show a large level of mental retardation, and they may need a special school to help them because they may not be able to cope with academics in a mainstream school. So while choosing a school for a child with autism, one has to be very clear that they are at least autism friendly in some way. They are inclusive in the right sense. And it's only after a month of schooling that the parent can probably realize whether the school is actually good. And there may be changes of school that happen at an early age. That also is one of the challenges of parenting of a child with autism spectrum. As the child grows in the teenage years, very often they see marked differences in personality and behavior. This differences in personality and behavior is very often seen because of hormonal changes that happen. The onset of puberty in children with autism spectrum may sometimes be earlier, it might be sometimes later. So you see delayed puberty and precocious puberty. And it's very important that do not get hyper about puberty happening or not happening because it can be delayed in some children. It's also very important that as the hormones pick up, testosterone being the male hormone, we see a lot more aggression and violence in boys with autism spectrum, whereas estrogen and progesterone, we might see some amount of social communication that comes up in the girl child. A lot of aggressive behavior, tantrums, and demands increase in the teenagers. At that time, it's very important that when this happens, parents do not give in to the tantrums, rather seek help from a professional in managing the aggressive behavior. because aggressive behavior can sometimes get too demanding on the parent, and it can also result in the parent being hit. It's very important to know that as a child with autism spectrum grows, the parent also ages together. So while the child reaches the teenage years, you will have parents who are aging, and that can make it a little difficult. We all know that autism is far more common in boys versus girls. So we see fewer girls with the autism spectrum disorders. This has also got to probably do with testosterone at the time of birth and otherwise. So you will have boys who probably show more symptoms, and girls with autism spectrum disorders are slightly rare. One of the challenges in the teenage years when it comes to the girl child is management of menstruation, which also takes a toll on the parents, because many of these children may not know how to manage themselves. Personally, they may not have an idea about hygiene, which affects the management of them during uh, uh, menstruation. There are certain other critical issues that come up in parenting. Very often, a lot of people ask me which doctor should treat my child. Should it be a pediatrician? Should it be a psychologist? Should it be a psychiatrist? Should it be a neurologist? Should it be a pediatric neurologist? The answer here is you could go to any doctor as long as they have an expertise in treating children with autism spectrums. Choose a doctor which is closer to your house. Choose a doctor which is nearer to your house. Choose a doctor who is easily available. Choose a doctor who will always pick up your call and answer you, because the queries are going to be a lot. And you have to have a doctor that gives time and understands the child and then prescribes medication or the treatments. It's also very important to look at certain sexual issues that come in the autism spectrum group, which is a very critical issue in parenting, because the child might touch the parent inappropriately. He might want to get close to the parent. He might get close to members of the opposite gender. He may touch girls or boys based on his own gender inappropriately. It can also happen that there may be masturbatory behavior that starts due to puberty. It's very important whenever these kind of sexual issues are seen, one has to distinguish which is the challenge, whether it's actually sexual behavior or is it sensation seeking. It's very important that we very often might think of many behaviors as sexual, but the autistic child may not view the same as being sexual, and it might be purely sensational seeking that has to be then decoded. Similarly, children with the autism spectrum also show social skills deficits and speech deficits. So you have three groups of children wherein speech may be totally absent. They are aphasic or they have no speech. You have children where speech is present to minimal amount, and you have some children who speak a lot. So generally, it has been noted that managing a child with autism spectrum where there are speech deficits is far more difficult. And the social skills deficits, where they talk out of turn, they might go and touch anyone inappropriately, they may not sit in one place, they may act restless, fidgety, often disturbs the environment. It's very important that one has to identify associated problems in the child. This could be behavioral issues, this could be shouting, this could be self-injurious behavior, this could be aggression, this could be talking to oneself, excessive flapping of the hands. So identifying these associated problems is very important, because parents have to realize we do not have any medication or cure for autism spectrum. What we rather have is management of the associated problems that can be done very easily. Also, parenting style has got a lot to do with the child's personality developing. So very strict punitive parenting can affect the child adversely. Very open-minded uh, parenting wherein the child is not corrected at all could also affect the child badly. You need to have a fine blend of strictness, a fine blend of a no-nonsense attitude as well as a fun attitude when it comes to bringing up a child with autism spectrum, and that is one of the critical issues in parenting. Another factor which we have seen in our work with parents is that very often the birth of an autistic child may cause some amount of discord between the parents. So there may be a lot of fights between the mother and father. There would be an initial blame game where the whole focus is to see whether the autism spectrum has come in from the maternal side or the paternal side, so that one parent and their family could be blamed. Also, there is a lot of marital strife and stress that happens post the birth of a child with autism spectrum disorder, and we have seen in our practice that divorces and separations are very high in this group. And you have a large number of single parents of autistic children that also exist. It's also very important that both parents agree on what the child needs, because one of the major challenges is that both parents disagree on what the child needs. And as a result, the child does not end up getting the right treatment for the right time, and very often the therapist is then blamed for that debacle. It's also very important that the involvement of extended family has to be judiciously done. So the brother, the brother's children, the brother's wife, the grandparents, etc., have to be judiciously involved, because involving too many people can result in too many issues being raised and decision making could become difficult. Whereas involving fewer people who are trustworthy is far more better. And also, we do not want members of the extended family to probably make fun or ridicule the child. It's also another challenge where you have one parent of the child with autism spectrum having an existing psychological problem. What we mean by that is that the mother already had depression prior to the birth of the child and the depression continued. Or there could be parents that develop psychological problems while they are bringing up a child with autism spectrum. The reason this happens is because there is a huge amount of stress. So, depression, anger, guilt, mixed emotions are all seen. There would also be a lot of negativity, and this could lead to depression in the long run. This could lead to anxiety in the long run. It could lead to panic attacks in the long run. It could lead to insomnia in the long run. So, when one parent has an existing psychological problem that has to be handled before the parent takes additional stress of managing a child with autism spectrum, it's very important that I always mention this, that the mental health of the parent is paramount. It is something which is always neglected. And the parent has to look after his or her own mental health, because for the next 20 or 30 years, they're going to be looking after the child with autism spectrum. Many parents, in their quest to handle two children or handle one child which is having autism spectrum, they somehow forget about the me time factor, and they do not have me time. And as a result, all their energies are invested in the child and they do not do anything beyond that. The parent also needs to have good sleep and relaxation. It's very important for their own sanity to be maintained and for their own anxiety and their own mood swings to be maintained. There is a need for good sleep. Parents and children with the autism spectrum should sleep at least 6 to 7 hours a day, and they might also have to undergo relaxation, which is very important. Parent support groups exist, but they could sometimes be a boon and sometimes be a bane. The reason being that not all parent support groups are run by a professional. Parent support groups which are run by a professional are far more important, because there is some direction, some structure, some management that does happen. Whereas if the group is run by a parent, it would fall apart because of everyone not complying with rules and regulation. The mental health of working parents is somehow more intact versus non-working parents. The reason for this is that non-working parents very often have to have spend all their time at home. So there's far more stress in bringing up the child versus a working parent that is away from the house for 8 hours or 6 hours, and a lot of the energies are invested in their work. And what also happens as a result is that the working parent has a buffer which prevents psychopathology from developing. Both parents also need to support each other rather than ridicule each other or blame each other or fight with each other. They have to be supportive of each other and help each other to cope with the trauma, because parents have to understand that they have a life beyond their children. So their life is not just the child alone. They have their own personal lives also that they need to look into. The child could be looked after by someone else for a few hours. They could go for a movie, go for a dinner, go for an outing, come back, so that they have some time away from the child rather than investing all their energies into the child. In our practice, dealing with parents of children with the autism spectrum, we have noted that depression is very common in parents of children with autism spectrum disorders. Anxiety disorders like panic, social anxiety, generalized anxiety, that is worry about anything, is also very common. In fact, WHO says that 1 in 3 people are probably depressed in the world due to multiple factors. So a common joke which I always share with people is, look to your left, look to your right. If they are both happy, then it's you. So you need to probably recognize depression in parents, bring them for help, recognize anxiety in parents and bring them for help. One also has to worry. Parents often have a worry about the future. One of their common worries is what happens to the child after us. One of their common worries is, as we are aging, who's going to look after the child. These are issues that also have to be handled. And we need to have parent pools and groups that come in and look after children, so that some parents can go out, do what they want, and so that their own mental health is maintained. It's also relevant that most people do not seek help for mental health problems, because they feel that going to a psychiatrist probably means that they're mentally ill or they're mad. So it's very important that the need to seek help must be there. And parents should not be in denial that, oh, I'm not that ill that I do not need a doctor, I'm not that ill that I do not need a psychiatrist. And they must not be in denial to seek help. Rather, they have to be open to seeking help from a mental health professional when they need to. There is no shame in feeling depressed or anxiety. There's no shame in feeling upset. There's no shame in crying. There's no shame in feeling suicidal. So one must, with an open heart and mind, seek help when needed. One of the common questions that most parents ask themselves is, why did all this have to happen to me? And why couldn't I have a normal child like other children have? And why is it that my child has the autism spectrum? And I always tell parents that it's not that it's you. What would you have done if probably you had a child who was deaf? What would you have probably done if you had a child who was blind? What would you have probably done if you had a child who had quadriplegic cerebral palsy and was on a wheelchair? At least you have a child that's moving around as otherwise normal. Yes, I know eye contact is poor. I know some cognitive issues are there. I know language is an issue. But you can't say, why did this happen to me? Whatever happened is here. What if you never had a child at all? So whatever happened is here, and you have to manage what has happened. Many a times, parents of autism spectrum disorders compare children. So they compare the progress of one child with another. They ask which therapist, they ask which doctor, and they turn to do what I refer to as doctor shopping. It's very important that do not compare progress of one child with another, because each child is different. Some grasp certain things better, some grasp certain things not so better. So one has to work in that direction. A common question which is often asked to me is that, does religion and spirituality help in the management of parents of children with autism spectrum disorders? Yes, parents who find solace in prayer must pray. Parents who find solace in religion must go in that direction. Parents who find solace in mindfulness, yoga, and other spiritual exercises must go in that direction. So it does help. A lot of parents also have a challenge in which they develop medical problems. So blood pressure, diabetes, thyroid problems, rheumatoid arthritis, skin infections, peptic ulcer. These are all problems that ensue when they are dealing with the child. And the stress, indirect stress, causes what are referred to as psychosomatic disorders. What we mean by psychosomatic is these are physical disorders that actually exist, but they are like blood pressure or diabetes, but they are exacerbated by psychological problems. So when there are psychological problems, the sugar may be higher, the BP may go higher. So there are medical problems in these children, which is also there. Parental stress has to be handled. A lot of relaxation, a lot of yoga, a lot of music therapy works best. And doctor parent partnerships have to be forged. So you have to have parents who have doctors who are available at the beck and call. They are available when something is needed. They are available when the parent needs them. They are available for answering all queries. And this is what results in a good doctor parent partnership. It's very important to understand that parenting is a very complex task, and it's a lifelong process, and one which is ongoing. So it's not something which is going to end today or tomorrow. It's a process which is always going and always ongoing. And it's very important to know that you're not alone. There are a large number of parents with the autism spectrum disorders who are here, and there are a large number of parents in the world that have the same problem that you have. They are probably at different stages of their parenting, some where the child is just born, some when the child is in primary, some where the child is a teenager, some where the child is aging. So the process is ongoing. Everybody is fighting a hard battle. It's not easy at all. Even parenting a child that otherwise has no autism spectrum is not easy. So I can definitely imagine that parenting a child with autism spectrum is definitely a very, very difficult task. Something which I often in my practice of the last 2 decades is, I always say, we refer to as children with autism as having belonging to the category of special children. I always say that parents of these children are special parents. The very simple reason I say that is because it's not at all easy for parents to have a child like this, look after them well, and still be smiling. In India, I have seen hundreds of parents have children with the autism spectrum disorder, but yet they do that parenting job with a very nice smile on their face. So they are special parents. And I always say, probably God, or if there's any higher power above, He knew that you would be the right people to probably look after this child who's wired differently. So therefore, the child was probably born to you rather than being born in another household. There are a number of small battles that have to be fought daily. Feeding the child, toileting the child, bathing the child. There are multiple things which have to be fought. And those are the battles which we win daily. If you feel your battle is to get rid of autism, that can't happen. If you feel that your battle is to get rid of other problems, no, that can't happen. But the key thing is some problems can be done away with, some problems can be solved, some problems may not be solved. But the final thing is that life is enjoyed by the small battles that we win daily. Before I finish, I want to deal with two cases which I would want to bring about, wherein I've had a parent who came to me and said, I want to discuss certain personal things with you. And when they discussed a personal thing with me, one of the things which they mentioned to me was that uh, I have a question. And she told me that why is it that I have a child who understands, he has high IQ, but his speech isn't there. And that the child was absolutely normal for a period of 2 years, and then the autism symptoms came up. There are still many theories for autism. We do not have any conclusions. So many people do not know the cause of autism as yet. And in medical science also, we haven't been successful. We have been fairly open to sort of deciphering um, um, the neurobiology of autism, but we haven't been able to probably come up with or elucidate a cause. So if parents are looking for a cause, I would not probably want them to look at a cause. I would rather say just accept that autism exists, and if it exists, then one has to probably work in that direction, move in that direction. I also will give a second example where I know groups of parents who come together and they form groups of 3 or 4, wherein one parent group, or rather one couple, that is a mother and father, leave the child with another parent. They go out, they enjoy their life, and they rotate this, whereby all the 4 children stay together, all the 4 children work together, all the 4 children are used to all the 4 houses, so they are able to stay there. And this parenting pooling is what gives parents a new lease of life. So it's very important. It's important for parents to realize that you cannot sulk and you cannot be unhappy and you cannot blame your life and you cannot blame your fate for having a child with autism spectrum, because that is something that did happen. I will end with a quote by John Lennon, who was a very famous rock star, who mentioned that when I went to school, my mother told me that the key to success in life was being happy. And when I was 5 years old in school, they asked me what did I want to be when I grow up. I said happy. They said that I didn't understand the assignment, and I told them that I didn't understand life. One of the very important factors is that we have to be happy in whatever we have. You may have a child with the autism spectrum, but that doesn't end life for you. You have a child with autistic features, it doesn't end life for you. Your battle is ongoing, and I will end by telling you that you're not alone in this battle. Myself and Autism Connect are with you. And if you need us, please feel free to contact us at any point of time. Thank you very much for listening to me on a Saturday evening. Okay, I will now take up certain questions that have to be answered. And one of the questions asked here is that I have a 3-year-old boy. Recently, our doctor has said that he's to be diagnosed as autism. Well, uh, autism can definitely be diagnosed at the age of 3. So if you have a doctor who has said that he probably has autistic features, then the issue here is that you need to probably get certain tests done, and you'll probably then be able to probably identify. So that a little bit of testing would have to be done by a professional, certain scales, certain methods, and then the diagnosis could probably be confirmed. Rajbar asks that how do we diagnose autism in early childhood? Well, there are multiple features of autism in early childhood. So they include the fact that speech may be impaired, eye contact may be poor, social skills are impaired, there may be problems with regard to milestones which are gained and then lost. And the main paramount feature is social skills disturbances and the child being lost in his own world. That would be a red flag in favor of autism. Apart from this, there are various early autism intervention scales that can be used to diagnose autism. So you would also want to use that. Someone has asked me what are my views about uh, ABA therapy versus anything else in the behavioral management of um, autism. In the absence of an ABA therapist, can we follow other approaches? Yes, definitely. There are many approaches other than ABA that work in autism. You could have a general eclectic behavioral approach, which is not necessarily ABA related. You could always have approaches which are based on the basic principles of behavior modification, which any psychologist or special educator could help you with. So ABA is not necessarily a must. How does one teach self-regulated behavior to adolescents with the autism spectrum? The answer here is that it depends on what kind of self-regulation you're looking at. So if you're looking at regulation of behaviors which are biological needs, it may be a little difficult. If you're looking at regulation of repetitive behaviors, that can be done by changing by certain environmental modifications, that can be done by certain changes in your approach to a particular problem. So I always remember we had a child where the child used to bring a steel tiffin box and bang it on the wooden desk, and it would disturb the whole class. We didn't do anything to the box or the child. What we did was we put Velcro on the desk, so the noise wouldn't come and the child stopped banging. So sometimes some kind of environmental modification also works. Lavanya asks, how can mindfulness or meditation be trained? Well, the answer here is mindfulness or meditation may be difficult in children with autism spectrum because their eye contact is poor. So it may be a little difficult to sort of do that. This is a very good intervention, however, for parents to reduce their stress. Mindfulness and meditation for parents, definitely, but may be difficult with children with autism. Uh, Bala asks me that my child underwent a BP shunt. All other activities are normal, but at the school they ask for a shadow teacher, whether to continue it or not for more than 3 months. Well, the need of a shadow teacher varies from child to child. The duration also varies. Um, I understand due to the BP shunt, there may be certain cognitive problems the child is undergoing. I cannot give a personal comment here, but I could definitely say that the shadow teacher is needed, maybe for 6 months, even to a year, after which the shadow teacher could be withdrawn. How can the parent handle the rivalry between ASD child and his sibling? The answer here is there are some children with autism spectrum disorder that realize that there's something not correct or proper in them. They also realize that the other child has certain advantages over them socially. They also feel jealous when they find that the other child gets more attention socially. So sibling rivalry does come up. Here, more than the autistic child, the normal sibling would have to probably modify certain things in his behavior so that he doesn't anger or hurt the child with autism spectrum. You would need to meet a special educator who would probably also counsel the child if possible, also speak to the sibling, make them sit together, look at specific areas where sibling rivalry happens, and that may then have to be worked. Once the child grows up, if parents look to keep the child in a special home, what would be your suggestion? Well, the answer here is that definitely the child could be kept in a special home, and there are very good special homes which are available. As far as possible, my personal take as a parent is that do not try and remove the child from the family. Let him be with the family. But if managing the child is not possible, there are special homes a little on the outskirts of Mumbai and other parts of India where the child could be kept. Visit the home, see how it is, see whether they have all the facilities, see that everything is available, see that it's comfortable. Keep the child there for a week first, see things go fine, see that food is available, see that shelter is proper, and after that you could probably take a decision. Mrinal asks me that, good afternoon, can I take the other issue if you please advise? Yes, you can. Uma says special needs parents. Uma mentions that does stem cell therapy or surgery work in autism? Well, the answer here is that my personal experience with stem cell has not been very fruitful. So I normally do not advocate stem cell therapy for autism. My personal thoughts on these are that autism is not a disorder where brain damage has happened, or it's not a disorder where neuronal regeneration has to happen. So stem cells have very little role. We have seen children and parents of both who have gone in for stem cell therapy, and we really haven't seen fruitful results. There may be centers that claim the same, but my personal experience has been negative, and I do not normally refer children for stem cell therapy. Tenaz asks about parenting communities. Well, it's a very good intervention if one looks at. In fact, autism communities and the autism commune is something that is also a good intervention that is coming up abroad and is something that we should look at in India. And I think it would be something very good to have an autism friendly community where parents and children could stay together, and you have siblings also who stay, and these children are looked after. How do parents manage parenting of two children when there is one special child? We often see that the other child without ASD comes with feelings of not being catered to enough. Well, this is a very relevant question asked by Pragya, because for the very simple reason that you do see many a times that parents focus on the child who's in a mainstream school and the child gets neglected. It's very important in such cases that one does not neglect the special child, because it leads to a deterioration from a psychological point of view, emotional point of view, physical point of view, and an equal amount of time has to be given to both parents. Sometimes a mother may need to look after education of the normal sibling, so the father may have to spend more time with the special child, or the uncle, auntie, relatives, grandparents would have to spend time. But it's very important that the child does not feel separated from the mother. As a result, what may happen is sibling rivalry may come up. You may also have a lot of aggression and abusive behavior that may come up. You may have depression that can develop in a child with autism spectrum, because he may feel neglected. And the worst that can be done is, because to cater to the needs of a normal sibling, the child may be sent away to a boarding school. That is something that should never be done. And an equal amount of attention between the two children is very important. In fact, we even advise talking to the mainstream child so that he understands the child with autism spectrum far better. Someone has asked me, how do you deal with aggression during the teenage years? She has a son who's 12 years old and on Sizodone 1 mg per day to control the aggression. Well, the answer here is that there are multiple other medications to deal with aggression. If you find one doesn't work, we need to look at other options and we need to try them out. Today we have newer medications other than Sizodone. I cannot really give you a personal comment because I haven't seen the child, but aggression can definitely be brought under control. Someone has also said that he's also had a first seizure just before the aggression and is on anti-epileptic medication. Well, again, here there are a multitude amount of medications to manage epilepsy in autism. Epilepsy in autism is a little difficult to manage because it's a little resistant to treatment. But there are good medications that we have today, good anti-epileptics, good medications for the aggression. So it can be managed. Maybe if the present medication is not working, you may need to go back to your doctor, consult your doctor, look at a change of medication, and it's something that can be work. Tehnaz asks, do you have any examples of such communities in Mumbai? Sadly, no. Tehnaz, in fact, you should take the initiative and probably start something. And I will be there to support you. Mithu asks, what do you say? Why did you say that parent groups could be a bane? Well, parent groups could be a bane at times. Well, I didn't mean it in the wrong way, because sometimes it could be a lot of comparing of children that happens. And some parents might feel that their child is not progressing while others are. It could also happen that there's a lot of parenting rivalry that starts, where each one wants to prove that though their child is on the autism spectrum, he's doing better than the others. So as long as you keep out personal prejudices and personal jealousies and comparisons out of the group could definitely be a boon. Ritu mentions that my child does not listen unless he's told in a loud voice. Well, some children do have auditory sensation issues, so they may have to be spoken to loudly. I would advise that your child sees a speech therapist and an occupational therapist and advise on this is sought. Martin thanks me for the webinar. Thank you, Martin. Mitu asks, explain the rationale. Please explain the rationale. The question hasn't been typed. Uma mentions any suggestions for handling aggressive behavior at home. The answer here is you have to handle aggressive behavior by having alternative channelizing behaviors. So swimming, aggressive sports, pillow fighting, having a punching bag at home, multiple things to manage aggressive behaviors. Roshni says, my son is 11 years old and has a tendency of breaking glass objects. Well, one has to keep glass objects away because he may injure himself. This kind of behavior is well known in children with autism. Little medical help sometimes may be needed. Mandisa asks, how does one deal with regression in the child? Well, you have a type of autism which is called regressive autism, where the child may show improvement and then regress again. It's difficult to deal with regression because one has to then restart all the therapies again and restart all the training again, bring the child up to a level, and sadly he may regress again. So one has to see whether this is a regressing remitting type of autism or whether it's a one-stop regressive kind of autism, and then based on that the management goes. Someone has said she's a clinical psychologist practicing since 4 years, and that's Ketki. and Ketki Gokhale. It's a challenge to manage parents more than the child. But as you said, acceptance is the key, but convincing them is hard. Convincing them is very hard. If I had a child with autism, I would not be convinced easily either, because I would not want, no parent would want their child to be diagnosed with autism. So I don't blame parents. I'm with them. And I know convincing takes time, but over time, probably they will understand. It's important that we don't push them. We explain to them, we leave them, let the ideas sink into them themselves. As I always say, that the diagnosis of autism is something which can't happen or enforced on anyone. It has to sink in. And once it sinks in, then probably they will accept. Um, Someone says, my child is a 3-year-old boy concerned about speech. Met with Dr. Meenal Joshi at Mumbai, and she said speech therapy is very important. Well, I think speech therapy is important. I cannot comment on what any other doctor mentioned, but I will definitely say, yes, if speech isn't there at the age of 3, please start speech actively, and I think it will definitely be beneficial for the child. Someone has mentioned we are from Ahmedabad and we need reference for a good speech therapist. Well, my number was there on the last slide. You could personally message me and I will get you in touch with someone good in Ahmedabad. My 3.6-year-old child, Mayuri mentions, is not verbal. And what type of therapy is good for him? Importantly, if you have a 3.6-year-old child where speech is a problem, speech therapy, animal assisted therapy, occupational therapy would work. Speech therapist would work on the vocal skills, is very important. Oral assessment would have to be done. Based on that, a speech therapy program which is individualized would have to be planned. Hi doctor, have you interacted with autistic adults or teenagers that are almost verbal, says Sahiti, and is this easy for them to self-support their daily needs and carry on simple conversations? Definitely. We have had a lot of autistic teenagers who we've interacted with, and with social skills training, they're able to definitely manage themselves. If you get in touch with me, I could put you in touch with parents of such children and they could probably guide you. At the age of 2, is it possible to diagnose autism spectrum, says Ketki Gokhale? Yes, we have had the tendency to even diagnose autism as early as 1.5 and 2 based on certain signs. Though we normally would say, okay, we would wait till 2.5 or 3 before we make a final diagnosis. Ravi mentions, can ABA therapy learned by parents online? Well, I don't think anything can be learned online which is therapeutic. You need to have hands-on experience with children. So I would not tell you to go for anything online. You rather to join a course which is full-time and then learn the same. Tenaz asks, how much is the overlap between SPD and ASD? Well, Tenaz, I don't know what SPD means, so I would not be able to tell you if it is specific personality disorder or speech phonetic disorder. Is it on those lines? The overlap isn't much because autism is a very unique condition, and speech related disorders are primarily related to speech alone. My son is 4 years old. He's still not able to tell us his toilet needs, says Ritu. And how do you deal with it? Well, Ritu, he would need to then probably be looked at first by a urologist to see if physically everything is fine with him. A urologist, or maybe even a physician, or maybe even a pediatrician. If everything is fine, then we look at why toilet training is delayed. You may need some medical help. You may need a little bit of re-toilet training to happen. Some kind of exercises may have to be taught to him. Someone has mentioned that a 9-year-old child is autistic and is recently becoming prompt dependent. And this is a question which has come to us by Mr. Srivastav. Srivastav, who's offline. Well, the answer here is that children do become prompt dependent, and there's no harm in that. It's important because at least giving him prompts will let speech happen. So please do not withdraw the prompts. I have a student who's severely autistic and he tried to burn the bed and enjoyed burning it, but he understands it will hurt him, says Madhura, and he has kept a proper distance. What is the purpose of him doing this? Well, any kind of sensory stimuli helps children, and not helps children, rather interests children with the autism spectrum. So you have children with the autism spectrum that love to probably play with water, fire, balloons, mirrors, sand, multiple things, and in your case, probably fire. So that's what made him probably do it. And I'm very happy that he knows it is harmful and probably won't do it. Otherwise, it could become a repetitive behavior that would need treatment. Roshni says, why is my child breaking glasses. I try to hide glass objects from him, still he's doing it. Well, there are fascinations, like I said. So glass, clay, paper, sandpaper, multiple things fascinate different children. So based on that, his fascination is there with glass objects. You would have to probably um, keep away glass objects from him. How many autistic children live a normal life like other children? Well, autistic children always have certain deficits which are seen, Hadia Jyoti, and therefore you cannot really say they lead a completely normal life, but we can try and make them self-sufficient. We can try and make them independent to some extent. How safe is ABSS Tenas? It's a very safe therapy. There's nothing wrong that can happen. Um, Someone has mentioned that, sir, can I take any other issue? Yes, Mrinal says yes. I have a 7-year-old with autism. We have decided to conceive another one. In this case, please advise. Minal, I can't really give you such advice here because the family, multiple things would have to be looked at, and an individual consult with any doctor would be far better than taking advice on a webinar. Kalyani says most of us are worried about the future. How do we overcome the worries? The answer here is you have something known as National Trust Act, where you may form a trust that is going to look after your child in the long run. He will have funds that will come to him. It will be court monitored. Apart from that, you could have other relatives who you trust that could also manage the child. Investments could be done wherein monthly income reaches the child. So there are multiple ways out. You would speak to your CA or your financial person, and he would be able to tell you. Ravi says, whose role is more important, OT or special educators? It's like asking whose role is more important, the mother or the father. Well, Ravi, the answer is that both play a very vital role and both have roles which are diverse. So we really cannot say that the autist is more important than the special educator. According to me, one is the heart and one is the lung. You can't do without the two. So you have to have both when it comes to managing a child with autism. Dhyana asks, how do we choose a particular therapy? Well, the answer is you have to see what suits the child and what makes the child improve. So when you see improvement, you choose a particular therapy. If you don't see improvement, you move to another therapy. Hi, sir. My son is 3 years. He's diagnosed as having sensory integration disorder. He's having trouble with eye contact and making sentences. He's on occupational therapy. It is working well. Only problem is he's unable to communicate well. And the doctor gave us risperidone. Is it safe? Well, risperidone is a very safe medication, Mahesh, I think, if I've got the name right. Yes, and it has been used a lot in children with autism. It is USFDA approved. It's one of my favorite medications for this group. So it's very safe. Please give it. And if it's helping the child, please give it, consulting your doctor. Don't be in a hurry to reduce it. A 3-year-old boy goes to OT every day, but when we came to Mumbai, doctor said the progress is slow, says Pujan. Well, speech is not developed and there are other parameters. Well, the answer here is OT takes a long time. So you would see progress in 6 months. If you're seeing no progress in 3 months, you need to consult your autist. If you're not happy with the autist, you need to change the autist, but progress has to be seen. Jayashree says, is drug therapy necessary? Well, the answer here is, Jayashree, that drug therapy varies from child to child and it depends on child to child. So we don't really say it's necessary, but it would depend on the symptoms, what's worrying, the biology, multiple factors, and an individualized decision is made for every child. Someone says their pediatrician told my daughter is at a risk for autism, and we did not go for a detailed diagnosis, but I've started therapy, says Sonal Bansali. And do we have to do a complete diagnosis? I would say first look at therapy. The child is young. Let's wait a year. Let's see how the child progresses, and probably a year later we could look at complete diagnosis. Which one is better, inclusive school or special education? Again, it varies child to child. What are our long-term aims? What is our support? What do we want to do? And based on that, Mr. Bamidi, it will depend on whether the special education matters or whether inclusive school matters. Uh, Someone says an occupational therapist and parents should sleep for at least 6 hours, but how do we do it? Well, Yashvi Faria says that the thing is, sleep problems in children with autism can very easily be managed when you look at there are good medications. We have some Ayurvedic ones, some non-Ayurvedic ones, some allopathic ones which work well. So they can be tried, and parents and children both could then have a good sleep. How do we prevent overeating for the child? That's what is asked by Sandhya Ahuja. Well, you will have to probably look at the calorie content. So you do not reduce the amount of food, but rather the calorie content of food could be modified so that he doesn't take in a large number of calories and yet feels full. Jayashree asks, can flapping of hands be modified permanently? With certain medications, yes, you may be able to reduce flapping of hands, though it may not permanently go, but you also would be able to reduce it with a lot of occupational therapy based interventions. Any respite centers in Bangalore is what Srivastav asks. Well, you could email me. I'll try and find out and let you know. Is mobile exposure related to autism, says Ketki, because they mentioned that mobile exposure, if reduced, autism reduces. Well, autism is already a disorder where there is social withdrawal. So if you have somebody who's going to be on a mobile, very often what happens is that the social withdrawal increases. So we say we should reduce gadget use in children with autism. And it's well known that children who at an early age have a lot of gadget use show a lot of social withdrawal. So it's very important that we have less gadget use in children with autism. Someone mentions their niece has ADHD. They are attached to one child in a school who's very short in height. How do you control it? Because I'm finding it difficult to manage her. That's what is said by Padmakar. Important thing here is that I think this is a school issue. You'll probably need to speak to the school and look at why this kind of an issue is happening and why there are the issues between friends. Probably speak to the class teacher, speak to the counselor, and I don't think changing the class would matter, but rather it could be sorted out in the class itself. Mandisa says, does neurological feedback therapy help behavior and communication? Well, it's in a sort of nascent stage. We haven't really seen magnificent results, but it definitely works brain-wise, but it's not my first line of therapy for the same. Ravi mentioned some people treating autism with immunotherapy. Is it not ethical? Well, immunotherapy doesn't work for autism. It's an experimental therapy and it's something I wouldn't advise. Can autism children be treated with other languages? Is it possible? Well, I don't think so. You'd rather stick to the mother tongue and train them with your own language. What type of insurance support is available? Well, I think there are some agencies that do include autism in their package and some that don't. You will have to look at the insurance plan in detail. I'm not really personally aware of that. What does the aggression return if medication is stopped? If medication is given for a proper time and tapered off gradually, aggression may not return. Do you believe homeopathy or Ayurvedic medications are effective? Well, I'm neither a homeopath or an Ayurvedic doctor, so I can't comment on that. But we have had cases where some medications have been used with success. Naive Disha is an NGO which also has a parent support group. It's available. Thank you, Lavanya, for that information. Uma says, does positive reinforcement help in controlling aggression? In some cases, it depends on the type and extent of aggression. When you have a lot of maniacal aggression or very predatory aggression, you really have to look at medication in such cases. What age should speech therapy start? As early as possible. The earlier you start, the earlier is the language development and better. How do you handle sexual behavior of a 14-year-old? Well, children who are 14-year-old have to be taught to deal with sexuality. They have to be taught that if they do engage in masturbatory behavior or self-stimulation, it has to be done away from others. It has to be done in the bathroom. It must not be repetitive. It could be done off and on when they want to. Touching the wrong areas of other people should not be allowed. Excessive hugging, kissing, sitting on other people's laps should not be allowed. And some amount of behavioral training with a psychologist or special educator would help. How would medication work for anxiety? Well, it reduces certain chemicals in the brain that cause anxiety, and therefore it works. Side effects are minimal. Today we have good medications with minimal side effects. Swapna says that thanks for the webinar. She wants to know about music therapy. Music therapy works in children with autism. Some children like music, some don't like music. It depends on the auditory sensation of the child. So you will then have to look at what suits the child and then decide. Someone has asked, a child has a sensory issue. He always is playing with spit. What do you do? Well, I don't think it's a dangerous behavior and something that has to be done about it. But if you feel there is excessive salivation, then that is something that can be dealt with. Yes, I realize it's sensory processing disorder and autism, TENAS. The difference between the two is that in autism, you also have other behavioral issues and you also have issues related to language, you have issues related to speech, whereas in sensory processing, it's purely a sensory issue. How do you train a young adult for the future plan, which is the place in India? Well, the answer here is you have to train them to be self-sufficient and you have to train them to be independent as far as possible. And there are some autism homes where they can be put. Dilna says they missed some part of the lecture. Will you get a recording? Yes, Dilna. It will be put up on the website and on YouTube, and Autism Connect will be there. The recording will be posted on the Autism Connect website by Monday, 6th January. So please await that. Someone says the son is 9 years old and is going to a mainstream school. School has no special educator. How do we know about victimization in the school? Well, you'll have to look at the school authorities and talk to them, and they must have a special educator. Otherwise, look at a change in school. How do you manage sleep problems? I think I already mentioned that you cannot manage it without medication. You would have certain safe medications that you could be done. My child keeps on playing with bottled wrappers of Aquafina and other wrappers. Well, it's there. These are all repetitive behaviors that you see in autism. As long as the behaviors are not damaging and troubling, I wouldn't worry so much. Um, how long do children with autism need to take medication? It varies, anywhere from 6 months to 5 years, depending on their symptoms. What is the right age for vocational training? Post the age of 12 or 13. How do you define a special educator? Anyone who has done a B.Ed or an M.Ed in special education and has considerable experience as a special educator. Um, Well, what we're going to do is now it's 5 p.m. and it's time for us to end the webinar. There are a large number of questions still left. So what I'm going to do is I will request Autism Connect to have all these questions collected and sent to me. And my personal assurance to you is I will have all of these answered, and they'll probably even try and put them up on the website so that you can have a look at them when possible. Or my email address is also there. I will just try and uh, give you that. Here, you can note my phone number and my email address down. If I haven't answered any of the questions, please email me personally. I'll be more than happy to answer your questions. Also, email me how did you like the webinar so that I can convey the same to Autism Connect. I partner with Autism Connect and work with them. So if there's anything, you can just let us know. And finally, just to let you all know that we are all together in this battle with autism. So with that, on Saturday evening, this is Dr. Avinash De Sousa who is signing off. Thank you and have a great Sunday.